This is Clinicians Roundtable on ReachMD. On this episode, we'll hear from Dr. Jeanette Andrade, who's an associate professor and director of the Masters in Dietetic Internship Program at the University of Florida. She'll be recapping her presentation at the 2026 National Kidney Foundation Spring Clinical Meeting, which focused on the rising prevalence of food and nutrition insecurity among patients with chronic kidney disease. Here's Dr. Andrade now.
So for food and nutrition security, when you look at the definitions side by side, they look very similar in regards to the fact that you need both the availability and accessibility of healthy foods to live a bountiful life. The caveat with the nutrition security is just more for prevention or reduction of chronic diseases and more or less the complications associated with them. So that's the main differences between them. Why this is a factor within the kidney disease population is because the types of diet and medical complexities that they actually have, right? Regardless of if they're currently on dialysis or they're not yet on dialysis. So when we look at the food security, when we look at large data sets like the NHANES, you can see individuals who identify as being food insecure, and if they have a lower kidney function, they have a higher prevalence of food insecurity. We have a food security screener tool. It's basically 2 questions that ask, like, over the past 12 months, have you been able to access and afford the foods? And so that's a quick 2-question screener that has been utilized frequently. Tufts University has identified a 2-item nutrition security screener that essentially is asking, have you been able to identify foods over the past 12 months that are healthy for you? If individuals don't know the concept, though, of healthy, right, and they're just assuming, yes, I could purchase fruits and vegetables, then they're going to indicate no issues. So even though they may identify that they're food insecure because they couldn't afford or access a food, they may identify that they're nutrition secure because they've been able to purchase at least some bananas, right? And so for them, that's healthy. So there's a combination of different type of screener tools, and especially as dietitians, typically within the dialysis center, it's being utilized, is looking at what types of foods they're typically eating, how many meals they're eating, what those meals consist of, if they have appetite, GI disturbances, and then looking at the labs to really identify, like, so if you say that you're eating great, but your labs are showing something different, or you're losing a lot more weight, or you're not gaining as much weight as you should, some indicators to kind of indicate maybe there's something else going on here, which may get them to more of that nutrition insecurity. But again, it's a lot of instruments that have to come together to really create a full assessment of, yes, they're nutrition secure. With food as medicine, I think because of that entire concept, a lot more clinics and facilities are actually using this produce prescription programs. I know there's a lot of successful stories with individuals who have been identified as being a diabetic or hypertensive. In kidney disease, you can see that there's a little bit of movement in that area as well. Some dialysis centers have food pantries so that once they get off their treatment, they can go into the food pantry to obtain the food that they need. At least there's a dietitian there to kind of help them, like, here, these are the products that you should be having, so tailoring it a little bit more. I think, too, with AI and everything else like that, there's now better app devices that are available for individuals so that they can kind of help monitor themselves. So if their serum phosphorus levels are abnormally high, they can identify, like, if they are consuming certain types of products, it would be beneficial to help reduce their serum phosphorus, or at least not to continue to increase it.
That was Dr. Jeanette Andrade talking about how we can address the rising prevalence of food and nutrition insecurity among patients with chronic kidney disease. To access this and other episodes in our series, visit Clinicians Roundtable on ReachMD.com, where you can be part of the knowledge. Thanks for listening.